Oh, I've got it, it's fine. I don't know if you want to give a brief introduction as well, like do questions, or we can just do questions.
Yeah, no, I'll give a brief overview, shall I, of kind of major milestones of the last year. I just wanted to kind of mark on the calendar for my own personal emotional reasons that my interview with this committee last year was my last public meeting before I went off to have my daughter Romilly accidentally nearly early. I don't want to say it was linked to how difficult the questions were that you asked me, but they said it could have been stress related. So yeah, I also wanted to put on the record publicly my gratitude and thanks to the staff at King's, because they were absolutely incredible. They work in very difficult circumstances, day in, day out. They looked after me, they looked after my daughter, and I have everything to thank them for. So that's just my little emotional bit. Right, I'll get on to the real stuff now. So there's been absolutely loads that's happened in my kind of portfolio area in the last year. Peter's touched on some of it already. I guess I wanted to mention, firstly, Free Swim and Gym. That was launched July 2016, the full offer, but I wanted to report to the committee that we've had over 76,000 Southwark residents now register for the scheme. We've had around 1,500 Southwark residents take up exercise on referral through the scheme. More than 50% of the users have been women, and also more than 50% have been from black and minority ethnic groups. So some really exciting work there to report, and some quite pioneering public health things, I would say. I also wanted to touch on, Peter just mentioned obesity. Last year we passed a new overweight and obesity strategy called Everyone's Business. That strategy is now in full swing, actions going on absolutely all over the place. I wanted to mention in particular our stage 1 accreditation now in the UNICEF Baby Friendly initiative. So that's an initiative to encourage breastfeeding and train up our health visitors to provide better support for new mums in breastfeeding. And also, as you're all aware, the Go Fizz Free campaign. So Fizz Free Feb is a Southwark born initiative, but now I've even seen evidence of dentists putting it alongside Change for Life in their waiting rooms. So I think we've reached the heady heights of our Public Health England level campaign. So it's had a lot of pick-up, and it's something exciting and Southwark branded, aimed at children, to encourage kind of awareness about the health damage that fizzy drinks can bring, especially when it comes to obesity. I also wanted to touch on air quality. So since last year, a new air quality action plan has been passed with over 100 different actions that range, well, they're really wide-ranging. But in particular, one quite high-profile win we've had is last month we've started with our anti-idling enforcement. So engine idling is not allowed, it's against the law. Our parking enforcement officers now have the power with their ticketing machines they have to ask, would you mind turning off your engine to an idling driver, and if they don't, they now have the power to issue a fixed penalty notice. So that's quite pioneering for us as well, and is a welcome kind of commitment on Southwark's part to try and tackle the public health crisis of the quality of our air in London. Just a couple of other things, sexual health. As you'll be aware, over many years, Southwark has had very high levels of need when it comes to sexual health and sexually transmitted infections. We're coming to the end now of a really exciting transformation plan that's gone on over a number of years. And this year, we've gone on to a new integrated tariff for our sexual health clinics, which is bringing us a significant saving to the tune of over £8 million over the lifetime of the contracts with King's and GSTT. But we're seeing over the last year a steady, slow but steady decrease in the rate of new infections, and also an increase in the number of tests being provided. So I think I'm not going to deny the level of need is still extremely high in this borough, but I think that that's a good news story and shows that we're kind of heading in the right direction in the way that we're tackling it. We also have, if you weren't aware already, the Elton John Foundation has come to Southwark and Lambeth with an innovative £2 million investment to look at new ways of tackling HIV in Lambeth and Southwark as well. So that's a really good news story for us, and a welcome kind of input of funding into that issue. So there are many, many challenges ahead in public health as ever in this borough. But I think that the public health team, with the arrival of Kevin, and that kind of really getting into the swing of not being a joint team with Lambeth anymore, having filled all those posts. The team's doing some really exciting work. There's loads of energy. I'm so happy with everything that's happened over the last couple of years I've had this portfolio. So I will leave it with that and final thing, social regeneration. Sorry, I got so into the swing of public health, and obviously you spoke about it a lot before, but social regeneration has been the other half of everything that I've been doing. The sort of two key milestones we've had in the last 6 months is that the framework document was agreed by Cabinet in September, and then Johnson and I, this is obviously a shared portfolio responsibility with Johnson, we launched and led the Southwark conversation, and we spoke to close to 3,000 Southwark residents in the broadest possible terms about how they feel about change, and it was really an opportunity for us to pause and listen and just gather that, take that temperature and feel what people are really concerned about, what they like, what they don't like. Because of the amazing response, nearly 3,000 people, it's the biggest consultation this council has ever undertaken on anything. It's naturally taking time to analyse the responses. We're bringing an initial report to Cabinet next month with the kind of top line findings, main themes that came up. We had a specific health question in there. And to your point before about GP provision, certainly anecdotally, when I was out doing a lot of those conversations, availability of GP appointments was something that came up again and again. And I hope that once that full analysis has been done, it will be a really powerful tool for us as a council to use in our conversations with the CCG, because that is a public consultation on the scale that no CCG, I think, would ever seek to or be able to undertake. So I hope that that will be really useful in that specific health conversation mentioned earlier. Okay, I'll leave it at that.
Perfect, thank you very much. Bill, you're first on
free swim and gym. I've got two questions.
Yeah.
Free swim and gym is the first one, and it's around how that's, what the effect is for the new contractors. When we introduced that, we were in the process of changing leisure contractors, and how's that been for them, and how's it fitted in with their business plan, and has it worked?
Yeah. Do you want me to answer that first? Yeah, sure. No, that's a very good question. So when everyone active came into the contract, it was, I think, if I remember rightly, about a month before the launch of Free Swim and Gym. So it was a very quick transition from them, from taking over the centres to launching the scheme. But the scheme was absolutely central to the contract negotiations. Right. So it's built into the way that they always envisaged delivering that contract. And despite the the pressures or expectations on delivering Free Swim and Gym, that contract is designed to begin paying the council back over time. So it was a really clever bit of procurement, and that was one of the ways that the scheme, the very ambitious scheme, was able to be delivered. Yeah. That timing worked really well with the new contractors coming in. Nonetheless, it was a huge undertaking. There was a lot of kind of back-end IT stuff that needed to be done, but I think overall that the launch of the scheme went pretty smoothly. There's been a few kinks here and there, but the contractors have been very responsive. It's Barry now that works directly on leisure with the contractors, but I found them very responsive, and when we have had the odd kind of complaint or something hasn't worked well for a resident, they've generally been very responsive, and I think overall there's a positive feeling both in the council and in everyone active about how it's running so far. But I'm always willing to hear, if there are concerns, if councillors are picking up concerns from residents about the contractors or about how Free Swim and Gym is working, if we're getting that balance right. With kind of the way that the centres are being managed during those busy periods and things, always feed them back to me or to Barry, because it's an evolving thing. It's totally new for us, totally new for them. So it's not going to be sort of always perfect, and we're happy to kind of facilitate any changes if needed.
Cool. My last question was around air quality, and it's great that we've now got the anti-idling policy coming into effect. Where are we on the milestones in reducing the carbon emissions along major roads, and our conversations with people like TfL?
Yeah, it's a very good question, because of course this borough has some massive TfL roads in it, and some of the most polluting roads in London, Old Kent Road, Elephant to name but two. I think it's very exciting that we have a new mayor who has kind of pushed air quality right to the top of the political agenda, and he has some really, really bold initiatives. The T-Charge has already come in, ULEZ is in the design. So I'm feeling hopeful about the long term, and as long as this mayor sticks to his bold commitments, then I think we will see a big change in London over the coming years. But we're in an interesting position as a council, because obviously a lot of the roads are ours and there are certain things we can do. So, we've got this air quality action plan. For example, I've recently been working with Better Bankside to help them. I supported them in a bid to get funding from the mayor to do some work around Borough High Street, for example, and kind of support that. So, for example, we can help by kind of expediting permissions to close roads or do innovative different things. So I think we're trying to be a really good partner in this battle against poor air quality. But it's very, very difficult, because a lot of it is to do with TfL, but also a lot of it is to do with the national government, frankly.
Yep.
And I've written several times now to the government about various things, pushing for a diesel scrappage fund, for example, because frankly we need investment in the problem, and if we don't have significant investment from the national government, I don't think we're going to see that step change we need nationally. So I've tried to position Southwark as a campaigner on that front, and just, we're doing what we can, but air quality does not respect the boundaries of our borough or even our city. But I think that doesn't mean we shouldn't be paralysed by the size of the problem. We should do everything that we can in Southwark, lobby TfL, hold the mayor to account, hold the government to account. But it's a very complex problem, as you know.
Yep, thank you very much.
Sonny?
Yeah, thank you. I was just wondering if any quality impact, which is similar to the question I asked Peter earlier on, whether any quality impact assessment being done, especially on swim and gym, because obviously there has been some very positive outcome, as you highlighted earlier, especially in terms of number of people using it and so on. However, sometimes in order to understand whether value for money has been achieved, sometimes you need to know, the quality aspect of it. Is there anything like that planned for the near future to know, even though there is a significant number of people accessing it, enjoying it? However, is it helping us to reduce obesity and also improve health of the population?
Yeah, great question, Sonny. I think the question I asked when I first took on the portfolio, and Freedom Gym was about to be launched, or I was about to launch it. It was an amazing sort of pledge for us as an administration, and really exciting, and people got really excited about it. But fundamentally, if we cannot measure the public health impact of it, then it's a nice to have, but why are we really doing it? Because there's a million things that we could do in this borough. Why have we chosen that? So those of you that are registered for it probably are now aware that there's a re-registration scheme that's just started. So every year we're asking those people who registered for the scheme to just do a quick, simple re-registration process. But as part of that, we ask some really specific health questions. So, has this scheme led to you being more physically active, and some quite specific questions. It's just started, so it's too soon for us. The initial analysis is looking really good, kind of like over 80%, over 90% saying that the health benefits are there and that they feel differently having used the scheme. But that's not statistically sound yet, because we've only been doing it for a couple of months. So I would say, if you're on this committee next year, ask the question again, and I think it would be worth us putting together a pure public health report about free swim and gym, and kind of digging down more deeply into both that demographic data, but also that those kind of really specific health questions. But as I said at the start, in terms of registrations, the kind of BME group is looking excellent, over 50%. Women, again, was a group that we were concerned that were statistically less physically active than men, especially between the kind of 25 to 45 age range, potentially, because they're more likely to have small children, it's more difficult to get in, and the cost of bringing a whole family to swim and things. So that's really encouraging as well. We also had 10% of users of Free Swim and Gym have declared that they have some form of disability as well. So that's another group that we were really hoping with our 7-day-a-week Free Swim and Gym offer that we'll be able to attract into our centres. But yeah, hopefully through this re-registration process, which is a rolling programme, that should allow the council to gather some really meaningful public health data. But as I said, it's going to take at least kind of 6 months of that process before you've got anything really kind of meaty to start analysing. But certainly it's been at the heart of the scheme since it was launched.
Thank you.
David?
Chair, I wasn't actually going to ask a question on Free Swim Gym, but I will pick up on it because it's been discussed by others. I mean, I hear the figures around the registrations, and I know that's good. I believe I'm right in saying when I last saw the figures, it came to the Health and Wellbeing Board, I think sometime at the beginning of last year possibly, but the number of actual visits is not quite so impressive in the sense of a lot of people have registered, but the number of visits they're actually making did not seem to be particularly high. Now, I don't know whether that's changed, obviously I haven't seen any more recent figures, but I think one of the things that I've raised before, and obviously I'm sort of reassured to some extent about the re-registration and the answering questions, but that if any public health money is going into this, that it should demonstrate that it's evidence that it's actually delivering. And I've asked, I think, the council to consider that, you know, if it means taking away Free Swim and Gym for everybody to have a more targeted provision, then I think that's something that the council should think of. And I don't know if that's something, I mean, I know you yourself won't be taking that decision in the future, but do you have any thoughts about that? I mean, would you follow the evidence in that sense if we need to target it and the evidence suggests that we should do that, to do that?
I mean, I hope that the model that we have currently means that we can actually do both. Because as I sort of mentioned earlier, the way that contract was negotiated with Everyone Active means that we're not actually paying per se to run the scheme. It was all kind of wrapped up with that initial cost of the contract. So it's not like a kind of separate pot of money that's going onto it. That being said, we do have targeted schemes that are funded through public health. For example, the exercise on referral, where we've had like over 1,500 or so visits in the 16-17 year. So I think that's probably what you're alluding to, is are we getting these specific health benefits from those that could
or possibly developing it to say so that, you know, for people who would most benefit from additional exercise, whether it's in regards to obesity or just people who don't do any exercise at the moment, you know, even improving the offer in a sense, so giving them sort of classes and things, or individual trainers, etc., to sort of, you know, to really boost their health. And in doing so, but maybe denying others who can afford to pay and already do.
I think I don't quite accept that dichotomy between one or the other, because I think we should keep that universal offer that we have built in within the contract and still potentially think about how we can better target. Because part of it, I think, is a marketing job as well. It's kind of making sure that people that could benefit the most do know about it. And I think that data that we're getting through the re-registration will really help us with that. Because, of course, the scenario that we do not want is that paying members of the leisure centres decide, oh, I don't need to pay for my membership anymore, I'm just going to use Free Swim and Gym. That is the scenario we don't want, because, of course, we need our contract to pay. That's how, you know, it's modelled on the fact that we'll retain paying members. And of course, being a paying member gives you completely different set of benefits. You can go whenever you want, you don't have to plan ahead, you can go to the classes. So it's a very different offer. So I think the ideal scenario is that, you know, we can, once we've gathered this data, the team and whoever takes on this responsibility in the future can kind of sit down and have a back to basics think about, why did we do this, how can we improve it. If we were going to put some more investment or move some investment, where would we do that? So I think it is something that should be constantly reviewed, because it is a public health programme and it's there for a reason. But I don't think it's that dichotomy between it's either for everyone or we have a targeted programme, just simply because of the way that it was initially procured through the contractor. And the contractor is really focused on health, and we can have really productive conversations with them, and we have, about things like what more can we do with them to work on issues like childhood obesity, for example. So we do have a really good relationship with them on that front, and I think there will be many more productive conversations over the next year about those specific issues. But I do think we can achieve both through this programme.
Okay. Well, that sounds good. Yeah. So one one's more about, I suppose, the wider perspective of public health, and So obviously as a borough, we've improved, and we're a less deprived borough than we used to be. In many areas, our health outcomes seem to be improving, although not, some from a very low base. But my worry is that some of these indicators are being delivered because, in a sense, without labelling it too much, but because of gentrification, effectively. So that the borough is doing better on public health outcomes because we have a larger growing number of middle class residents, and that actually the people whose health outcomes are the worst still remain probably really bad, and that really what we require is more targeted provision of our public health services to the people who really need it most, who've got the worst health outcomes. And I'm not sure that at the moment that we tend to go for sort of universal offers like free school meals, like free swim and gym, general sorts. Obviously, we have to have open access in regards to sexual health, but I just wonder whether we're getting the balance right in a sense of really targeting the people. So from BME communities, people on low-income households, the LGBT community in different areas of sexual health, we're really getting to those people who actually most need the help and support.
Yeah, no, you raise a very...
It's a big issue. I know there's a quick answer. But,
No, it's really big. And when I first took on this brief, I went down to Guy's and sat down with Professor John Moxham. I don't know, some of you have probably come across him before, and you're definitely dancing to his tune in what you said just there about kind of when you look at data, you can look at the overall picture, or you can dig down underneath it. And he's been a lifelong campaigner, tobacco campaigner, right? So he kind of thrust these enormous reports into my hand and was like, I was going off on holiday, and he said, this is your holiday reading, off you go. And this is what health inequalities is all about. I took it, and I sat on the beach and I did read it, because I'm a geek. And what he said, for example, tobacco is a really key example of what you just alluded to. So overall, smoking rates in this borough have decreased massively over the last couple of decades. But if you dig down, those health inequalities are really, really stark. So the category of people that are defined as routine and manual workers, so what we're talking about is lower income people, the rates of smoking are still unacceptably high. And those of you that clicked when I sent round the ward profiles, the ward health profiles, if you clicked, some of you probably were very, very shocked at how high the lung cancer incidence rate was in your ward compared to the England average. So I think, Dave, that's exactly what you're talking about. But I hope, in having done my geeky reading, I demonstrate to you that I share those same concerns, and that those are conversations that we have in the public health, team all the time. Because you're absolutely right. We need to balance out those universal offers, free healthy school meals, for example, with our kind of steely focus on childhood obesity and its correlation, for example, to bands of deprivation. So one bit of work we've been doing that's quite interesting, or conversations we've been having, is with the Guy's and St Thomas's charity, because one of their strategic priorities for the coming years is addressing childhood obesity. They look at Lambeth and Southwark, but there's a band of inequality, health inequality, that runs straight through Lambeth into Southwark. It's a kind of L-shaped band. And so we've been talking about kind of working with them to do some very targeted work in certain specific wards, certain communities, to make sure that that concern that you have is not being realised, that we are using the full firepower that we have as a local authority in public health on those that could benefit the most. But I truly believe that you can balance that out with these universal great offers that we have for everybody, because everyone still has something to benefit from: more physical exercise, a healthier diet, better air to breathe. That is something that everyone has a right to, but at the same time we have to target what we have in a world of massive financial constraint on those that have the most to gain.
Any other questions?
No, I'll leave it at that.
Helen?
Thank you. Thanks, Maisie. A couple of questions about children and young people's health. So one was quite a big picture question, again, about how we're working with schools, and particularly given cuts to school budgets. Are you seeing some things that would have been funded to improve health and well-being, whether it's to do with childhood obesity, mental well-being, other things? Do you see schools retreating from those kinds of programmes at the moment, or do you think that actually that's being sustained? And another question, which was about something that we discussed when Professor Fenton was here last time, which was about the new integrated youth offer. that has been pulled together. I know it hasn't been long, it's just been a few months, but I was just interested to get your perspective on how that was going and also what the measures of success are for that work.
Great question. And one I kind of wish I had Vicky Mills next to me because she has a direct relationships with schools. But what I can say is that, especially in terms of kind of childhood obesity and those issues, relationships with schools is absolutely key. And we have a successful programme, kind of London Healthy Schools award programme that we've been running. We've also, through our obesity strategy, we're now funding a specialist healthy weight school nurse, for example. So I think in those kind of really specific areas that we've been trying to target, there have